Yes, pancreatic cancer is surgically resectable. In general, about 15 to 20% of patients are found with early cancers that can go on to surgery. These cancers are usually smaller and not growing into any major blood vessels. And in general, they tend to be stage 1 and stage 2 cancers. If the pancreatic cancer is found at an early stage where we can offer surgery, then there is a chance the patient can be cured. And in general, when we used to do surgery alone without additional chemotherapy, that number was unfortunately small. It was usually less than 10% of patients who were still alive at 5 years outside of the surgery date. Then, with newer and improved chemotherapy techniques, we now use a chemotherapy after surgery that has 4 chemotherapy drugs. 3 are the chemotherapy and 1 is a supportive medication to help one of the chemotherapy drugs work better. And with that, we've been able to improve the 3-year disease-free survival, and that is the patient is alive and well without cancer back in their body, and we've been able to improve that to about 40%. In order to know if the pancreatic cancer has been treated and is not returning, we have to follow the patient for 5 years. If the goal of the treatment is to have the patient go to surgery, then surgery is the main modality for cure for pancreatic cancer. Then after the patient has their surgery, we will start chemotherapy after a thorough discussion, and the chemotherapy is meant to improve the cure rates. We also send patients for a discussion around radiation treatments, especially in select cases where the surgery was excellent, but sometimes there's microscopic cancer cells that may be left behind. Thankfully, that's rare, but we do send for a discussion around radiation if that happens. If the goals of the treatment are to control the cancer because it has spread and we are dealing with stage 4 disease, then the main treatment modality is chemotherapy. Chemotherapy goes into the vein and it goes all over the body. So we need to use chemotherapy to control and help the patient avoid getting worsening symptoms. Then if there's a pain that's very focal or if there's bleeding, then we will send the patient for radiation treatments. In the control situation, very rarely we will do a palliative surgery if we're dealing with a blockage that needs to be bypassed.